Hello, my name's Leonie Short. I'm an Associate Professor in Oral Health here at CQ University. And I'm really pleased to be talking to you today about something that I feel really passionate about, and it's feedback strategies and formative assessment. And it's very important to us in oral health because students are practicing on patients their competence in dental procedures. And it's how we as teachers give that feedback and also how students receive and respond to that feedback. So please enjoy Take 5 on feedback strategies. Formative assessment and feedback strategies are key mechanisms that assist students in their learning and in their development as evolving professionals. In the field of oral health or dentistry, the presence of the patient and other family members adds an extra dimension in which in the way in which teaching and learning is undertaken by clinical supervisors in students in dental schools. And the reason why is that all the constructive feedback from the clinical supervisors needs to be delivered in a manner which is tactful and reassuring to that patient who's lying there, but it's also got to be immediate and accurate for the student. So I actually say that the feedback has to actually be modified or altered in a way, because you can't be as direct as perhaps you want to be, because you've got to be assuring the patient, but also getting your message across to the student. So it's actually quite hard to do, to protect the patient, but also give the student that clear instruction. So in all clinical environments, it's time pressured. And so I was thinking about how can we better prepare dental and oral health students to receive and respond appropriately to formative assessment and constructive feedback in a range of our settings. And so it was decided that we'd actually develop some DVDs in order to assist in that way. So we developed good and bad scenarios, and it was in 3 different settings: in the prosthetic laboratory, the simulation laboratory, and in the oral health clinic. And these were scenarios that were actually based on experiences that actually happened. So they weren't just based on imagination. They were real cases that actually happened whilst I was at Griffith University for 7 years, and a whole multidisciplinary team helped develop them. We're now using these DVDs to prepare students and staff in the Bachelor of Oral Health here at CQ University. And it's important that it's both staff and students, and also important to think that it's not just something that's taken for granted, that we just automatically give feedback correctly and students respond correctly. I believe that it actually needs to be taught, and taught in such a way that we're being as effective as we can with how we give feedback and how students receive and respond to that feedback. There are key points in the DVDs, and this is just a range of some of the points: self-assessment, peer assessment, stress, taking on board feedback, task orientation, receiving a lower grade than expected, overconfidence of the student, etc. These are just some key points or messages in the DVDs. Okay, so let's now watch one of the DVDs. This is one of the bad scenarios.
Have you finished the cavity prep?
I suppose so. I don't know what else to do. Last week Dr. Baker told me to go deeper, and then Dr. Young told me the pulp of floor wasn't even. So I can't do it properly if I have different people telling me different things. And I wouldn't have gone so deep if I hadn't been told to do so.
Okay, let's have a look. Oh. You have stuffed up the cavity prep. It is way too deep.
Yeah, well, I wouldn't have done it if Dr. Young didn't tell me to.
Yes, David, can I help you?
Thanks, Dr. Bolton. I just want some feedback on my cavity preparation. Last week it was just too shallow, and then the pulpal floor was uneven. So I tried to even it out. Now it's just become too deep. I should become so frustrated. I think I should just stop, take time out, gather my thoughts. Can you suggest any ways of getting the floor depth right?
First of all, it's really good that you stopped when you did, because that's a good coping strategy. As for the cavity preparations, we don't expect everything to be perfect at this stage, but there are some things you can do. When we first started, can you remember back to what Dr. Baker and Dr. Young said about the cavity preparations?
I remember they should stop regularly and check the floor depth with a perio probe.
That's right. Have you got a perio probe on your bracket?
Yeah, it's just there.
Excellent, okay.
But I've forgotten to use it. What was the trick of getting the floor smooth without going too deep?
What we suggest is get the outline right, just go shallow, then when you're happy with the outline, go to the correct depth. And just use a gentle stroking action with the handpiece.
So having seen that, I hope you can see how there are better ways of doing it, better in terms of the student getting the right information and being able to respond to that information. I've got some tips for teachers though. The feedback should focus on the task itself. It should focus on the process of the task, so actually how you do it. Students need help with how to actually do something, on their self-regulation or their coping mechanisms, and also for us understanding them as people and with feelings, as people. But also for us in the clinical setting, the patient care should always take a priority over the student assessment. Now, there are tips for students. The student should listen rather than immediately rejecting or arguing. They should be clear about what's being said. If they don't understand it, they should ask for more information. They should ask for the feedback that they want. They should decide what they will do as a result of the feedback, so how they're going to change doing something to make it better. And they should also thank the person giving feedback. And I think these tips for both staff and students are a really good way, clear and simple way of how to do feedback strategies in an effective manner. So in conclusion, this may be an example from oral health, but I also think it's applicable to allied health, nursing and other occupations where students need to develop competence in specific skills. Feedback strategies and formative assessment is important for all students. If you want any further information, please don't hesitate to contact me. I'd be more than happy to assist. Bye for now.